Tell me this story where you've changed somebody's life with functional medicine.
So I have one that is literally, her surgeon told her, "You're really lucky you have her as a physical therapist. Otherwise, you'd probably be dead." And that's Lauren. And she, 28-year-old female, chronic patellar dislocator laterally. They did some imaging, decided that her patellar tendon was attached too far laterally, and that's why she was dislocating. So they were just going to do an easy surgery to relocate the tendon to where it should be.
Is that speak to me as a dumb pharmacist? Is that a common thing or surgery?
No, it's not a very common surgery. It happens. It's probably in all of orthopedic knee surgeries, it's probably less than 0.01%.
Oh, wow.
And the people that you'll see it in are probably more hypermobile than you would expect anyway. And they tend to be, most of the time when we see someone who's a patellar dislocator, they were either a dancer or a gymnast when they were younger. And the first time they dislocated was typically between the ages, it's a female between the ages of 10 and 15, because they went through a growth spurt and all of a sudden their body said, "Oh, wait, we're not going to hold this position anymore."
Okay, that makes some sense. So tell us about her story.
So she had her surgery, came to me 6 weeks after surgery because they had wanted that knee to stay immobilized to have the patellar tendon really solidify in its new position. And we were supposed to just work on range of motion and getting her strength back. But the first day in the office, I'm going through the history and what's been happening since surgery. And she's talking about 6 weeks of these migraine headaches that are relieved by nothing, not migraine medication, not pain medication injections, not ice. And they happen at the same time every day. They're happening between 2 a.m. and they last until almost 4 a.m. daily. She had been to the ER. She had called her surgeon. She had talked to everybody. They labeled her as drug seeking at the ER, even though she wasn't even taking pain meds for her knee because it wasn't helping and she didn't need it for the knee. And that first day, do you remember, because you're about the right age, do you remember those thermometers that were like the mood readings that you could stick on the forehead?
Oh, yeah. Yeah.
So I have those because when we see patients a lot of times after surgery, we want to know what the temperature is day one, because I usually get them 1 to 2 days after surgery. And then I want to know what the temperature progresses to be, especially if they start having more complaints of pain or swelling increases a lot, those kinds of things. Or if there starts to be a look of infection to the joint, I want to know what the temperature changes. So I take temperatures of people's surgeries, skin level, in my office on a regular basis. And so I took the temperature of her leg and it didn't even register, like that nothing on the thing changed. And I was like, okay, her leg does feel really cool to the touch. I asked her if she'd iced. She said no. And I was like, all right, well, we'll go with this. Her range of motion was a lot better than I expected. I sent her home with a couple of exercises. She comes back 2 days later and she's got bruises, like small bruises, maybe the size of like a thumbprint, up and down the opposite leg and a little bit on her abdomen. And she's still complaining of the headaches. And the surgery side feels fine. So I ask her if she minds if I do a little abdominal palpation, and she's super tender around her liver to the point where she's flinching with just like 1 pound of pressure touch. I mean, just like you would touch a tomato and try not to leave an indent kind of thing. And she's fresh out of college, but she's got on really nice jewelry, like jewelry that is expensive. And so I asked her, do you mind if I ask a question that's going to sound a little biased, but I swear it's related? And she's like, no, go ahead. Why? And I was like, well, you're 28. You're a year and a half out of college. You just started your job. How is it that you have some of the nicest jewelry I've ever seen? Like, you don't wear costume jewelry. It's all 24 karat gold. And she's like, oh, I'm allergic to nickel. And I was like, oh, great. Okay. You said you have your surgeon's cell phone number? And she said, yes. And I said, I need you to call him right now. And she's like, why? And I said, we're going to have him meet you at the ER. And she said, what do you mean? I said, we're not treating you today. You're going into liver failure. You're having a reaction to the pin they stuck in your leg.
Wow. 'Cause
And
nickel.
yeah, from nickel. She was allergic to the pin. She was allergic to the bone cement. She was allergic to the glue. And she had like a full blown autoimmune reaction. And her liver was trying to detox all of this stuff all at the same time and just went into failure. And yeah, they put her on immune suppressant drugs for 2 weeks until they could get to the point where they felt like she was healthy enough to take out the pin. And when they took it out, her bone was green.
No way.
Yeah. I wish I had the picture still.
Yeah, man. Yeah, you did save her life.
So yeah, that was like the biggest, like, okay, I'm doing the right thing in looking into all this functional medicine stuff, because it literally is all, your body is one ecosystem. And if we're just treating the individual parts and pieces, we're doing people a disservice.
Absolutely. It's about fixing the problem, not just treating symptoms.
Yeah.
And I can't imagine, Marci, if she hadn't have found you, I can't imagine, because eventually she would have ended up in the ER. You were put in that place for a reason, because I don't think, the chance of anybody else finding that would have been slim.